Hi, this gentle floor-based yoga practice is for low back pain. If you have a herniated disc or you've recently had surgery to remove a herniated disc and you've been cleared for movement, this practice will be gentle enough to help you begin to heal and regenerate strength and mobility. But first, I want to talk about something. If you have a tendency for things to need to be challenging, difficult, or hard to be effective, or you have a tendency to push through, I'm going to ask that you set that aside for this gentle, short practice because these postures are going to be slow, targeted, yet effective. But if you feel like you need to move quick or you need to really be feeling it and sweating for it to make a difference, then you're going to come into it thinking, this isn't going to work and I'm really bored and yoga's not for me. And I don't want you to come away with that feeling. We're going to start really slow and return to this practice over and over until you feel the strength and mobility returning. Then you can begin to increase your time, increase your postures, and get back to more of your own baseline. For right now, you're healing, and we want to help your body heal through gentle movement and mindfulness. So please come onto your back with your knees bent. We call this constructive rest. Nice and slow, unhurried. With your feet hip distance apart, feel the back of your hips making contact with the earth. Notice your back, your spine, shoulders, and the bottoms of your feet. Tune into your breath for a moment. You could place your hands on your lower belly, and as you inhale, notice you're breathing into your hands, your belly expands. And as you exhale, belly tones towards your spine. Be with that breath for a few cycles. Let your awareness soak up just a little bit more of your breathing. See if you can exhale just 1 or 2 counts longer than your inhale. There's no need to count, just have the felt sense that your exhale is slightly longer. It can be helpful to slow the first third of your exhale down. That can make your exhale breath slightly longer. 3 or 4 more breath cycles at your own pace. If your body begins to relax, just take a moment to notice. And slide your hands over your hip bones. Imagine that your hands are glasses of water, and we don't want to spill the water. So press down into your left foot, and as you inhale, lift your right knee up towards your chest. Only go as far as you wouldn't spill your glass of water, and then lower down. Shift the pressure from your left foot into your right and pick up your left knee. Alternate through these 5 or 6 times. See if you can do just about 30% effort that you would normally. If you're not sure what kind of effort you would bring, maybe you could focus on slowing the pace down. Don't forget to shift the pressure, pressing down into the earth before picking up the opposite knee. Let's do 1 or 2 more times to each side, depending on your pace. You don't always have to push through. And right now, your healing journey is about slowing down and being more intentional. With both feet on the mat, pause here for a couple breath cycles. Allow your arms down by your side and press down into your hands and your forearms. Start pressing down into your feet. And as you're pressing down, inhale to lift your hips up towards the ceiling. Exhale, lower slowly down. We'll do a total of 10 of these, so 9 more. But please listen to your body and where you're at in your journey. Doctors and yoga teachers can make really helpful recommendations, but they can't feel into your body. They don't know what it's like for you. And that's where you have a responsibility to yourself, an agency. So perhaps just doing every other one is enough for you today. And you can work up to doing 10. Let's do 2 more. When you complete, pause. We don't need to rush to the next posture. We can take breaks and pauses in between and let ourselves transition. Step your feet as wide as your mat. Inhale to center. And as you exhale, lower both knees to the right. They need not come all the way to the floor. There's no striving or forcing here. As you inhale, come back to center and lower both knees to the opposite side. Inhale back to center. %30 effort. The next time your knees go to the left, let that be the last one. Stretch your left leg long. Let the weight of your heel get heavier into the earth. And pick up your right knee in towards your chest and support it with your hands around your shin or your hamstring, or perhaps just rest them on your knee. This is the shape. This is the posture. So tune into your breath at your lower belly. We can arrive into our yoga shape and let our body and breath do the rest of the work. See if you can become the witnesser to your breath as the inhale reaches toward your thigh. And the exhale, belly descends down towards the earth. The mind's tendency is to want to make meaning, or can make you feel like this might be boring. It's not working. See if you can, again, set that aside and just become a little more curious about your breath. Extend your right leg long. Just pause to notice any circulation returning down your leg, any warmth or tingling. Pick up your left knee and support it with your hands on your shin, hamstring, or knee. Stretch your right heel down a little longer and let your right heel get heavy. If you'd like, you could close your eyes and tune in to the expansion of your belly on the inhale. And notice the way it hugs your spine on the exhale. Let your whole body get a little heavier, a little more relaxed, a little softer. Extend your left leg to meet your right. And again, here, notice any circulation returning down your leg. Place your palms face down on the ground. Let your ankles splay open. Close your eyes. And for a short moment, once more, tune in to your breathing. You don't need to breathe a certain way, but just see if you can witness, watch your body breathe you. Thoughts and sensations may arise. You can just notice that's a thought, that one's a sensation. But try not to need to follow the thought or investigate the sensation. Just for a few more moments. With each exhale, let your body get a little heavier, maybe 10% more relaxed. Begin to deepen your breath. Wiggle fingers and toes. Slowly turn your head side to side. Add some bigger movements like rolling wrists and ankles. If you'd like, you could give yourself a full body stretch, but do this at about 30% of your normal stretch. And then bend one knee before the other and roll to one side. We'll pause here for a few breath cycles, letting our body recalibrate. Before you just sit right up, press down into your hand, support yourself. So push yourself back up to your seat. I hope this gentle yoga practice supports you in your healing and your recovery journey. If you have any questions, please leave them in the comments. And if you know of somebody who has had a herniated disc or has one that could benefit from this practice, I know since my husband had his herniated disc removed about 5 weeks ago, there's been 4 or 5 community members to let us know that they also have had a scheduled surgery for the herniated disc. So please be gentle with yourself and your low back. Thanks for sharing this time with me. If you did like this practice, I teach every week on Sunday. It's a very gentle practice to help you reset your nervous system, which will help you to support your immune system. When your immune system is healthy and functioning well, it can take care of that herniated disc all on its own, or it can help you to heal faster. When our nervous system is not running optimally, and most of ours aren't, then it creates a hindrance for our body to do what it knows how to do best. I hope to see you again.